Well, are you one of the 60,000 viewers for my Norton's Neuroma video? That's why we did a second video on Morton's Neuroma about defeat. That's right, defeat, because I'm DeFabio. But seriously, the last video talked about how someone came in with a diagnosis of Morton's Neuroma, and I said, really? Really? You had 3 docs look at it, and they all gave you injections blind, and you're not better? Really, Morton's Neuroma? It's not. What was it? It was an irritation of the interdigital nerves in through here. But why? It was a real chiropractic problem with the foot. What's chiropractic about? Chiropractic is about restoring movement to joints that don't move properly. Where there's abnormal motion, we want to restore that if it's moving too much or too little. And then it's about releasing nerve pressure and muscle irritation to the area as well. This patient had a bunionectomy surgery, which is your big toe here. And after the surgery, the patient wasn't able to flex the foot up like that, all right? It was straight, but it couldn't flex. So every time that patient walked, rather than the foot doing this, right? See how the toes all move, right? They move up onto the metatarsal heads. The foot was doing that. It was doing that. So these last 4 toes were getting jammed up because this one wasn't moving properly. So as we get this one moving properly, and as we take the pressure off the tendons and ligaments in the front of the foot, the forefoot, now the foot can flex better. Now that the foot can flex better, there's less irritation on the interdigital nerves where neuromas show up. So that's what that patient had. But regardless of whether you have a previous bunionectomy and hallux rigidus, a stiff big toe, and that's causing pressure on your interdigital nerves, or if you just have pressure on your interdigital nerves from wearing tight shoes, or because you're on your feet all the time, or because maybe your arches are starting to flatten. Regardless, what do? We make sure that the joints are all moving normally through the whole forefoot by your toes, as well as in the midfoot, as well as in the rear foot. There are 8 bones in your ankle. Sorry, there's 7 bones in your ankle that all have to be freely movable. Then you got another 24, I believe it is, in your foot. They all have to be freely movable. And when they jam up, when they lock up, it causes irritation to the tissues. We can adjust every one of those bones in your foot. Because in our office, we're not just spine-only doctors. You see my videos. Elbow videos, shoulder videos, hip videos. We can adjust any joint in the body, jaw, anybody, if it needs it. Sometimes we got to do exercises to strengthen it. That's our job, to figure it out. The bottom line is, just because your pain's here doesn't necessarily mean your problem's there, but if it is stuck, if it is restricted, if the ligaments, the tendons, the muscles aren't flexible, if the joints aren't flexible, you need adjustments. You need chiropractic care on that area. So, Morton's Neuroma, maybe, could be a neuroma, but if we can get pressure off of that interdigital nerve by getting the foot to move better, guess what? You don't have symptoms. And that's the name of the game. Let's treat the underlying cause of your symptoms. And that's what we're all about. I'm Dr. Donald DeFabio. It's been a great day to talk defeat and Morton's Neuroma. Really? I hope you saw my premiere post today. If not, check it out and be one of the next 60,000 people to read and watch about the foot in Morton's Neuroma. Have a great day.